So today I'm going to talk about one of the most critical components of ADC Part 2 OSCE, and that's effective communication cluster. Now listen carefully. This cluster is just as important as the infection control cluster. Why? Because in ADC's eyes, if you fail infection control, you fail the exam. And the same applies here. If you fail effective communication cluster, you fail the OSCE. So let me show you how to master it step by step with real practical examples. Now, what is the effective communication cluster? In every OSCE station, examiners are assessing how well you speak clearly, show empathy, listen actively, avoid jargons, and communicate safely in a way that your patient can understand. Even if you're clinically right, poor communication is considered unsafe. So let's fix that. Now, step 1, build trust from the start. So what you can do is always begin your OSCE like this. Hi, I'm Dr. Sara Niazi. I'll be taking care of you today. Could I confirm your name and date of birth, please? That's your safety check. It shows professionalism and respect right from the first moment. Step 2. Use the ICE method. To understand what the patient is thinking and feeling, ask, what do you think is going on? That's the I, idea. Then you can ask, is there anything you're worried about? That's the C, concern. And then you can say, what were you hoping we could help you with today? And that's the E, expectation. Now this builds trust and aligns your care with their expectations. And ADC loves that. Step 3, avoid jargons. Always explain things in plain language. Don't say pulpitis. Say the nerve in your tooth is inflamed. And then say, if you want to tell the technical term. So if you use a technical term, define it immediately. ADC expects clarity, safety, and not complexity. Now, step 4 is structure your explanation. You can use this format, which is diagnosis, options, that is your treatment options. Third is your risk or limitations. And fourth, of course, is consent. It keeps you organized and helps the examiner follow your logic clearly. Step 5, finish with confidence. So you can end your station saying, okay, to summarize, we are going to remove the infected tooth today. Do you have any questions or anything you would like me to go over again? Now that shows you're not rushing, you're checking for understanding, and you're being thorough. So what I want to tell you is just don't memorize, connect with your patient. OSCE actors want a real empathetic conversation and not a scripted one. Though you can use framework like to stay structured, but let your natural communication come through. Because at the end of the day, this cluster is about safety. So just like infection control, you can pass effective communication to pass the OSCE. So take it seriously, practice it, reflect on it, get some feedback. And trust me, when you get it right, it shows.